Hello, everyone, and welcome to this afternoon session of the International Manchester Public Health Festival. And we've just had a lively plenary in the morning that you might have been at or not. So welcome if you're joining us anew, or welcome if you're coming back. And this will be the lockdown papers, the COVID lockdown papers. And we've got a great panelist you can see here. We can't see you, but I hope you can see us. And I'll just ask Aparna Verma to do some introduction and housekeeping. Over to you, Aparna.
Thank you so much, Marcus, and welcome to this special session. I am just going to share a few slides with you and very much welcome interaction in the Q&A, but also we have our Twitter handle of hashtag PHFest2021 that we hope that you'll be able to use. We'd like to ask you to look at our programme because we have a whole host of different sessions that are reflected in this web link. For the programme at a glance, just to remind people that we have indicated the start times, and then each of the sessions are between 1.5 and 2 hours long. We'd like to remind you of Zoom etiquette, that we'd like you to be on mute with your cameras off. We have a whole host of prizes for the best oral and poster presentations, so we hope you'll join those sessions. The Q&A function will be dependent on the session, so please take your cue from the chair. We will be recording and live streaming most of the events, so please again have a look at our YouTube channel and the programme to get details of this. And we are going to include the Q&A for those questions that we don't get to answer during the sessions. We have a fast-moving programme, as we have a number of late breakers, so please have a look at that programming, and if you have any technical issues, please email much@Manchester. But we're so pleased to have you, Marcus, and our fantastic panelists for today's special session. We're very much looking forward to hearing all about the current and future plans, and I'm sure there's going to be a lively discussion around all of these key issues about the core things that we can learn from what we've been doing in fighting the pandemic, both nationally and internationally. So I'd like to hand back over to you, Marcus, and our huge thanks and appreciation for pulling this session together. Thank you.
Thanks, Aparna. Great introduction. And so welcome everyone to the COVID lockdown papers session. You've got a great panelist here. I'll be introducing the session and what we'll have in the session, and then saying a few more words about the COVID lockdown papers. For now, what I'd like to do, so we've got the Q&A, and the chat, I believe, is open. If you could use the chat to introduce yourselves. We've got 43 participants at the moment, and do say a bit about where you are, what you're about, what your interest is, and your names. That'd be fantastic. So we have that in the chat, but let's use the Q&A just for specific questions to the panelists. And if you name which panelists, all or specific panelists, that'll be really useful in handling the Q&A. So I'll ask the panelists to turn their cameras off now, but you will be introducing them in a moment, and I'll tell you a bit about the lockdown papers and how this has emerged. So this session is going to begin with information on the lockdown papers and two questions that I want us all to bear in mind. One is, are there any lessons emerging at international level? and how can we share potential solutions between countries and between cities with similar contexts. And you'll be introduced to each of the papers that the panelists have written. They'll present their papers and also hopefully then have a discussion. That's sort of what I call part one. And part two, I'm wanting to move the agenda on to something, a question I put: will we see a more health-focused turn in urban policy? And planning often uses this idea of turns, the collaborative turn in, or an economic turn in planning. Will we see a more health-focused turn in urban policy? So let me just introduce myself, also the scope and the aims of Cities and Health, the journal within which this session is set. So I'm Marcus Grant. I've been working with the World Health Organization Healthy Cities Programme, the European network, for some 20 years, and more recently, more internationally, on the same agenda with WHO in Geneva on the urban health agenda and UN Habitat. I'm an urbanist and landscape architect professionally, but have also been working in public health for many years. I'm editor-in-chief of the journal Cities and Health, which I founded, and now we've collected a great team of people around that journal. And what I was looking for was, I felt there was a gap in a built environment journal. And I'll explain that why I've said journal like that, that focuses on people's health and planetary health from a built environment perspective. And when I say journal, it's really a network. We set the journal up to be a network and a point of conversation to support this transdisciplinary field, where we've a multi-sectoral field between all the disciplines and professions that create and help create and shape our built environments, and between research and policy and practice. So that's a bit about the journal. And the journal, then the session is about the journal. Last year, in fact, on the 3rd of April, we had a call. We put out a call for what we called immediate contributions. We used immediate contributions. We said the public health crisis caused by the rapid spread of COVID-19 is having a very profound impacts on societies throughout the world, and we will continue to do so for years to come. We're in the midst of emergencies. So this is April last year. The day-to-day actions of health providers, government, communities, and individuals will shape the impact of COVID-19, as has been seen with other pandemics and epidemics. Whilst we don't want to detract from the emergency response, there's a need to capture the initial insights and potential for innovations for urban health as they emerge. And that was the real thrust of the lockdown papers. And we put out a call through many channels, through Twitter and on websites. And we said that these papers will be valuable in reflecting later on the wider implications that this crisis provoked for the long-term approaches to public health, for the way we manage and design our cities, and how the agenda of public health and urbanism can be shaped together for the future. So this is a sort of first look at those papers and a first reflection. There's a wealth of experience, insights, information that were laid down. We put out the call, as I say, and we had 2,000 hits on the websites and downloads of the call. Then we had 200 international teams or authors submitting an expression of interest. We had so many, we bulked up an editorial team. There's 4 of us in the whole editorial team. Waleska Kafira from Brazil, Geraint Ellis at Belfast, Caroline Brown, who you'll hear from, Edinburgh, and myself. And each of us looked at, independently, 2 of us looked at every expression of interest. And then we invited 70 authors to submit. And from that, we published through late summer and autumn, 51 papers. They're all available free and online, free to access and online now, 51, what we've called the lockdown papers. And we're sort of working together with those now. We've written an editorial, which we've just published as well, called The Urban Syndemic of COVID-19, Insights, Reflections and Implications. So I'm wanting to immerse you in that work now. We thought we would get, I'm just reading from the call here, we thought we'd get 10 short think pieces. And as I say, we're overwhelmed. We had papers from Wutan, we had papers from the WHO, huge wealth of international papers, a lot of them about informal settlements, slum developments, etc. So let's have a look at we can gain further insight into what this means for urban design, urban planning, city governance. So I just want to, that's my introduction really. I just want to allow in Aparna, Verma, if you want to say any words about that, that focus and that content. Aparna, if you're still there.
Certainly am, Marcus. And just to reflect on that need that you're really tapping into about the response that you've got from people. And I think one of the key things going forwards that was reflected in our plenary earlier today was how we as public health, urban planners work together with policymakers to ensure that the right information gets out. And I think the journal is a great exemplar of being able to really think through that interdisciplinary science that we need to really propagate so that we can not only tackle this pandemic, but our epidemics across both communicable and non-communicable diseases going forwards as the majority of our population globally are working and living in cities. And I think pulling in the core concepts of what both the urban health section, when we set that up in UFA, and I know, Marcus, we've always found your contribution to the section as being invaluable, together with some of the things that we might be doing with WHO or UN Habitat, and then thinking through non-governmental organisations, and then the local impact. I think one of the key things that we have at the moment is that people are listening to us, whether that's society or the politicians. And I feel now we've got this opportunity that's probably once in a lifetime to really build resilient communities, neighbourhoods, as well as national and international structures that will ensure that the lessons learned from the pandemic can really be implemented and thought through as we go forwards into the next stage of our response to this pandemic. I think one of the key things, again, that was mentioned is that often we see both funding and also messaging almost being competitive in nature, so doing one thing over another. And I think having that holistic picture under the setting of urban health is one of the most important components of what we can do as an interdisciplinary group, and having the ability to really think through all of these core issues is absolutely fundamental, and really pleased to be part of the panel and take questions after. Really keen to hear what the attendees think as well. And I know we are working collaboratively with many of you on either research or teaching components of our work, and how we bring that all together for capacity building was again something that we discussed at the plenary this morning. How do we educate so that when we have fake news or the issues that we have all been encountering with not just the pandemic, but prior to the pandemic, how do we educate it And some of our research has really focused on that linkage now between health, digital, media, and financial literacy, and how they're inextricably linked. So very keen to think through some of these concepts. And again, thank you, Marcus, for the ability to discuss these important topics.
Thank you. I've just been notified that I had asked people to introduce themselves in the chat, but apparently the chat's only open for panelists. So do feel free to introduce yourselves, and there's 49 participants just in the Q&A for now. So it'll be clear that those are the introductions to people. And Greg, if you could sort of put those up and make those so as people put them in, so everyone can see them. It'd be great to see who's in this session and where you're from, what your interests are. That'll be really useful for us all to create a community around these lockdown papers. I'm just going to bring in Caroline Brown there, who was on the editorial board. She's also an author, but as a member of the editorial team, as we discussed quite a lot, that we didn't want this to be a time capsule where everyone wrote their papers and we buried them. So we're very much, this is something to keep dipping into, and insights. Maybe you would like to say a bit more from your experience of being on the editorial team for this sort of fast and furious process.
Yeah, it was really exciting to be part of it, and we had lots of discussions, as you can imagine, amongst the four of us who are collating and handling this wasn't exactly a tsunami, but it was certainly a wave of interest, and you know, much more than we anticipated. So it's really interesting, really exciting to be on the receiving end of that. And we had lots of really interesting discussions about the themes that were emerging, the things that people were noticing, and also how we saw this contribution. And as Marcus said, we did talk about this idea of a time capsule, this idea that these papers would be a reflection of what was happening, that's something that we could go back to, and we'll come on later to talk about how we might move forward in the journal to use these papers, and what might happen next with a second call. So I think, yeah, it was a really interesting time. We were of course conscious about the people who weren't able to contribute, and I think that's something that we still need to be mindful of, that certain voices, certain researchers, certain practitioners found it easier in the pandemic to get on with their work and to have their work heard and their voice heard, and other people found it harder. And there's lots of reflection to be done about intersectionality, not only in the way that COVID has affected people, but also in the way that research has been constructed and the narratives around that. So I'm really interested, really excited in this conversation and being able to talk to people about these papers, because of course we haven't had those opportunities, and we've all had to adjust to this extraordinary new way of doing everything online, through a screen, looking at each other and looking at everybody's houses, or seeing people walking past in the background. You might have just seen one of my children. That sort of thing. The home became the workplace, and I think that's also an interesting part of this narrative about who lost and who gained from the context, the new pandemic context. I could go on, Marcus, but I think I should stop. Thank you.
Okay, great. Thanks, Caroline. So if you would mute and turn off your camera. So let's have a look at the work. So we've got five authors here, 4 papers. I want to have a chance for everyone to look at those. So we'll begin with Andy Jenkins. Hi, Andy. If you switch on your camera, etc. So Andy has submitted and published a paper. I'll just read the title: Biotic Systems as a Critical Urban Infrastructure During Crisis, Learning from the COVID-19 Pandemic. So Andy, just tell us a bit more about where you're from, and let us know about your paper. Thank you.
Okay, thank you very much, Marcus. Thank you for the introduction. Yeah, hi everyone. My name's Dr. Andrew Jenkins. I'm a postdoc researcher at TU Delft. Used to be at Queen's University Belfast until last year. My background is in architecture, urbanism, and urban agriculture. And I'm currently involved with a program that explores the building integration of vertical farms to understand to what extent that industrial symbiosis and exchanging of heat and resources could actually move us towards zero carbon cities in the future. My paper, as Marcus has already told you the title, the premise of the paper proposes to view COVID-19 as a stress test for cities to determine their underlying weaknesses and to rectify these in preparation for either future pandemics or future climate change catastrophes. So what I will do now is I will share with you a few slides and I'll just give you sort of a synopsis of the paper itself. So biotic systems as a critical urban infrastructure during crisis. Human well-being is sort of the focus of this, really. You know, human well-being consists of security, either, you know, food security, financial security, the necessary materials for a viable livelihood so that you can build a home or at least live in a home that's been built, freedom, choice, good health and good social and cultural relations as well. And what we've seen is that COVID-19 has actually led to a significant impact on a lot of these factors that are cornerstones of human well-being. Many people have experienced drastically decreased financial security. There has been food shortages, although maybe due to panic buying rather than anything else. There's also been, as we've all experienced, many restrictions on freedoms, which has led to a reduction in meaningful social interactions. You know, so collectively, we've all taken a bit of a battering over the last 18 months, and we're all feeling it now, just how difficult it could be. And the paper talks about the fact that, you know, that it's difficult all around the world, but, you know, it's really, really difficult in cities, you know, where people might not even have a balcony, you know, let alone any green space. You know, I'm quite lucky. I've got a front garden and a back garden. I have some greenery. I have a park, walking distance. But if we look at this image here, you know, this city doesn't have that. And it's missing critical infrastructure to actually maintain well-being during a crisis. And depression and anxiety are higher in urban areas anyway, which can be further exacerbated due to poor connections with the green space. And COVID-19 actually led to 10% more of the population reporting, you know, feeling as if their well-being had been impacted by COVID-19. You know, and I think now is the time to view COVID-19 as a stress test, so that we can, you know, adapt our cities meaningfully for future pandemics or climate crises to make sure that they do maintain at least a minimum bar of well-being in the future. And I talk about climate change as well because there's similar impacts between climate change and COVID-19 and other pandemics. But the thing about COVID-19 is that the impacts will probably be quite short-lived compared to any future climate crises that we experience. And at the minute, 150,000 people are reported to die per annum due to climate change. And that's set to increase by up to 250,000 people per annum as an estimate by 2050. That's primarily driven by diarrhea, malnutrition, and decreased yields and things like that. But heat stress is also part of those estimations, which is apparent in cities which experience heat stress due to the urban heat island effect. So what I propose is a biotic revolution. You know, some of the previous noted factors can be addressed through the integration of urban biotic systems, i.e. kind of green and blue infrastructures. You know, and I propose that these need to be, you know, we need to be able to directly integrate and interact with these infrastructures. So, you know, I use words like touch and smell and taste. You know, we need to be able to taste these green infrastructures and smell them and interact with them so that they actually have a meaningful impact on us. You know, and I suggest that in the paper that these should be within and upon buildings, but also throughout cities. And that's broken down into three kind of constituent parts. One is improved access to green space. The next one is food production, and finally, thermal comfort. Green spaces, as many of you may know, you know, leads to, you know, a really positive experience for human well-being, can reduce blood pressure, reduce stress, and strengthen the immune system. And in the UK, you know, we have policy and standards such as the Accessible Natural Green Space Standard, which kind of describes minimum distance to a green space. But that's only in 2 dimensions. You know, it's a really difficult standard to apply to a 3D object such as a city. You know, if we take the UK's tallest inhabited building, for example, the Shard, you know, if we're looking at minimum travel distances, well, the Shard should sit within a park because it's 300 meters high. And those at the top of the Shard should be able to, as anybody else should in London, be able to access green space within 300 meters. So we need to start viewing the city as a 3D object and not purely in plan, to make sure that actually those minimum travel distances are adhered to. You know, and if we move to buildings such as the Burj Khalifa, you know, that would need 2 sky gardens, 2 sky parks, as well as a park at ground level, to make sure that those minimum distances are adhered to. And I also propose that, you know, that these green infrastructures should be nested as well. So I use the word nested a lot. So that's sort of small within big within bigger, basically to improve resiliency, but also building redundancy. So as through COVID-19, we are restricted, you know, there was many restrictions. We weren't allowed to travel, you know, to the great outdoors. So they became redundant. So, you know, we then needed to look at smaller and smaller scales. But if you know, if you live in some cities which are highly populated, you know, those smaller infrastructures aren't there. So the resiliency is very poor and the redundancy is not built in whatsoever.
Andy, could you bring this to a conclusion? Yeah,
okay. So also mentioned about food as well. So you know, the ability to produce food is a cornerstone of well-being, and that can be integrated within green spaces as well. And also proposing a unbroken link to help mitigate the urban heat island effect. So, you know, you've got a plant within your house, there's then green walls in the building, there's then rows of trees which lead you to parks, so that you're always connected with green infrastructure. So that improves your well-being. It also improves the ability of cities to dissipate heat through evapotranspiration. So final thoughts are, basically, you know, I categorize city as broken because they don't adhere to a lot of the anthropological needs that we have anyway. You know, and there's a lot of scope to improve cities in the future to make sure that nested biotic systems could lead to change. But there's lots of research that needs to be done, whether in lab or quasi-experimental research, and also research by design to actually picture and envisage what these futures might look like and how we adapt cities to deal with future crises.
Great. Thanks, Andy. Thanks. That's a great opener with the 3D city. And I like the that idea of COVID as just a stress test for future challenges to city living that are already creating many thousands of deaths in cities, urban deaths. So questions are coming in, but let's deal with those at the end. So Martin and Luke, be great to move to your presentation. So Martin and Luke have been publishing a paper called Global Change Increases Zoonotic Risk, COVID-19 Changes Risk Perceptions, a plea for urban nature connectedness. Over to you. And if you also describe, which I think is quite interesting, the different perspectives you both have from your own different professional standpoints. Over to you. Cheers.
Okay, thank you very much, Marcus. I'm not a Zoom specialist. Is my presentation visible?
Yes.
Yes, okay, good, thank you. Yeah, first to introduce myself, my name is Maarten van Hove. I'm an assistant professor in biology at Hasselt University in Belgium. As a biologist, I mainly work on the evolution of parasites. And in fact, if any of you know or are parasitologists, you'll know that COVID-19 is actually from the perspective of evolutionary parasitology, a quite interesting scientific challenge. Now, I know nothing about viruses, but I am, apart from biologist, also a social cultural anthropologist. This combination, being biologist and anthropologist, gave me an vivid interest in One Health research and practice, and this is why I'm very interested in this field. We took the initiative of this article and this talk today together with someone who has granted me permission to introduce him in his name. My former boss, but yet we still talk to each other and are even friends, Dr. Luc Janssens de Bisthoven, also a biologist, ecotoxicologist, who has both an academic profile and also worked in Academic Development Corporation and is now head of a program funded by the Belgian Development Corporation in the Brussels Natural History Museum, focusing on capacity building on biodiversity in the global south, both to Belgian and African policymakers, ministries, and biodiversity scientists and academics. The points of view that we want to combine in our manuscript and the talk today stem both from biodiversity science as our first professional background, and development cooperation, because we were both very involved in academic capacity building in biodiversity related fields, and both of course have tendencies with health policy and health research. Now, I will not introduce everyone on our author list individually, but just to give you an idea, they come from a multitude of institutes and a multitude of disciplines, both rather fundamental natural sciences and more health or applied sciences. Now, what is the network or the forum that brought us together? Actually, there are two. On the one hand, the Belgian One Health network, which is obviously an interdisciplinary network of the various actors, scientists and other actors involved in Belgium interested in One Health. And actually, it's a quite young network. We did the the launch event actually a couple of months before the lockdown, and November 2019. But even though it's a very young network, for us, it already had a very interesting internal capacity building consequence, because it was great networking to meet other people interested in One Health, and it actually helped bring together this author list. And then secondly, the program which Luc is heading, as I just mentioned, at the Brussels Natural History Museum, which is working for Belgian Development Corporation and for the Belgian Federal Science Policy, advising the South and Belgian policymakers on biodiversity-related matters in the South. For instance, to help guide Belgian Development Corporation, but also to help our partner countries set up, for instance, a biodiversity policy or a biodiversity science policy. And so that's why we thought that we had something to say, that we had a contribution or a point of view to share that perhaps not many people automatically think of when thinking of a lockdown in their own city, being the perspective of the global South in this story, and particularly of the role of urban nature in the global South. So this is the reasoning behind our manuscript. Now, what were the two main observations that we very naively in March, April last year started with when we thought, okay, this is interesting to write a manuscript about it? On the first hand, we noticed, and that was also noticed in the public literature back then, as we see this paper of Lisa Maffioli that I share a screenshot, that the reaction to previous epidemics was very, very different compared to the reaction to COVID-19. If you think, for instance, of Ebola virus disease, which we were quite familiar with in the Belgian media in view of its connection with Central Africa, of course, that quite mediatized zoonosis elicited, of course, very little practical response in the global north until some missionaries got ill. But otherwise, of course, apart from the different biology or epidemiology of the disease agent, we also thought that our perception of risk and the risk of being influenced by a zoonotic disease ourselves in the global north had enormous influence on how the world as a whole responded to a pandemic. And then also another observation we made, and that's something we had actually published about a couple of months before ourselves, is that when, although many people are very aware of the role of nature in health and disease, people see nature as something kind of dangerous because they know of zoonosis, that is a very one-sided view of nature when it concerns human health or disease. And so we think there are three levels at which urban nature or urban green should be reconsidered, rethought, if we want to mitigate the effects of pandemics and help steer a pandemic response policy. On the one hand, we think that the ecology of pathogens in an urban context deserves more research. And to give an example from the global south illustrated there, of course, bushmeat markets, wet markets, whoever you may call them, create many new interfaces between humans and animals and their environment, which obviously merit a special scientific interest. And although urban ecology is quite fashionable these days, we think that parasitological pathogenic aspects of that are quite ignored or overlooked. Secondly, what we'd like to call a multi-species ethnography, because humans share their built environment, urban environment, with a lot of animal species. And often we are focusing on limiting the distance between them and us, or even eradicating them for instance, in the case of mosquito vectors. But as this picture from Dar es Salaam, Tanzania, illustrates, it's often, there's a lot of other things one can do in terms of urbanization to help limit the risk of disease transmission and so on, not aiming at eradicating these animal species, but just at reorganizing the city, because in the case of mosquitoes, so well and good to spray your whole city or try to trap mosquitoes, but as long as there's buckets and ditches lying around in the built environment, there's of course enormous risk that is actually easily avoided. And then thirdly, more on a community scale, community psychological scale, thinking about the health effects of urban nature, which is something that Andy just talked about. Obviously, there's a lot of environmental injustice when you take disadvantaged people and in their living conditions, for instance, in slums, into account. And again, speaking of the global south, thinking of the global south, the picture I showed here is from an Indian city, where there are, of course, very, very basic needs, not only just access to nature to help mitigate the stresses of lockdown, but also just access to water or to environment to exercise. These kind of injustices are, of course, enormously increased under lockdown conditions, and also show that lockdowns, as in cities in the global north, cannot just be transposed to the global south. And so to sum up and to perhaps, sum up our proposal for solutions, these both Ebola viral disease and COVID-19, in our view, result from new interfaces between humans, animals, and the environment, that on a very different scale, also because of the very different levels of mobility involved, caused relatively local epidemics in the case of Ebola, or global pandemic in the course of COVID-19. But we think in both cases, a different interaction with nature, reconsideration, and perhaps a more positive, more integrated approach of the connection between nature and people could go a long way in solving these challenges. And in the case of COVID-19 in cities, as I said, we propose 3 levels to reconsider nature, being the scientific study of the ecology of urban parasites and pathogens, the ethnography of the interface between humans, animals, and the environment, and the community level, community psychology of access to urban green infrastructure. Thanks a lot for your attention. I'm looking forward to our discussions on this later. Thank you.
Thank you, Martine and Luke. Some really interesting concepts there about that relationship, the urban relationship that we have with nature. Let's move straight on. Paul Pilkington. Switch your camera on. Everyone else mute and switch your cameras off. So Paul Pilkington, who is in fact in Bristol, an ex-colleague of mine, and we've worked closely together. Great to have you here, Paul. Paul's presenting a paper that comes out of a multidisciplinary co-authored study, Pandemics, Vulnerability and Prevention, Time to Fundamentally Reassess How We Value and Communicate Risk. Over to you, Paul.
Thanks, Marcus. Can you hear me okay?
Yeah, I can hear you.
Great. Yeah, so I'm an associate professor of public health at the University of West of England in Bristol, but I'm part of a big research consortium called TRUDE, which is looking at the urban development process and how health can be better integrated into that decision-making process. It's an upstream level, so I'll come back to that issue in the final slide. And as with the other presentations, this summarises a paper that we published in Cities and Health. And the paper was looking at how we assess and value and communicate risk in response to the pandemic, but also thinking about other threats which have already been discussed, such as climate change. So one thing that we know, obviously, is there's been a pandemic over the last 18 months. It may have come as a surprise to a lot of people in terms of the impact that it's had on society globally, but it has been long recognised by the World Health Organization and domestic health and government authorities to be at the top of the risk register, along with climate change and higher than terrorism in terms of being a threat to society. So it's not that we were taken completely by surprise by this. But what we've seen during the pandemic, and has been mentioned briefly in the earlier presentations, is that the impact of it has been felt disproportionately across populations. Obviously, globally, it's very stark, the inequalities, but also within industrialized countries, there are huge inequalities in terms of who was exposed to the virus and who continued to be exposed to the virus, for example, through their occupation, and also who gets most sick when they contract the SARS-CoV-2 virus and potentially develop COVID-19, so the disease associated with the virus. And we do know now that there are very clear risk factors associated with becoming more severely ill and dying, including obesity. So we know there's that strong relationship. What the pandemic has done is shone an even stronger light on the inequalities in our society. Particularly in our context, the quality of the places in which we live and those places that which we have access to, which can act as a mitigator against such a shock to the system as the pandemic. What it suggests is that the lack of planning for this eventuality in terms of pandemic also flags the lack of planning for the eventuality of the inequalities associated with climate change and the ecological crisis. What we know in public health and also other sectors as well, and we've been saying it for a number of years, is that the health service is not responsible for many of the wider determinants of health. And so as Marcus mentioned, he and I have worked together for a number of years with colleagues at the university and beyond, thinking about the wider physical built environment and how that impacts on health and who needs to be involved in that in terms of professional groups, such as planners and architects, and also the community as well. Our project in upstream, funnily enough, focuses on that upstream level. How can we change what's going on at that very strategic level, which impacts on those downstream vulnerabilities? For example, how we design our cities, and how we try to equalise the inequalities which exist in terms of where people live and the resources that people have access to. Now, our paper talks about how the weaknesses that we're seeing as a result of the pandemic are created by political and economic decisions, which generally prioritise short-term economic gains and consumption-based growth over longer-term health, equality and sustainability.
Oh, can I just stop you for a minute? There's just some people are questioning, are you trying to show any slides or not? We weren't sure. It's all,
not see the slides.
We can't see the slides, but I mean, it's coming across loud and clear. You're communicating really well. So maybe I didn't even think we were missing them. You were communicating so well, but we couldn't see the slides.
Can you just see me then?
Yeah, we can see you.
That's strange. So I was
try again.
Screen, but I'll try again.
Yeah.
I know when it is does say I'm sharing my screen, but anyway, let's try again. I might
switch it off and then try again.
Yeah, luckily there are only 2 slides.
Yeah, that's it. We're there.
Okay, great.
If you want to just take it through from
Can you see the full slide now?
You can see the full slides. We're good.
Fantastic. Okay. So basically, this was my first slide. So hopefully that's very clear in terms of what I've already said. And just onto my second slide now. So so basically what we're seeing now, and especially the debate about whether we and how we reopen societies around the world and how we cope with the longer term impact of the pandemic, and that economic versus health argument is really showing that kind of conflict that we've got between that short term political economic view and that longer term health sustainability, and a lot of people argue economic view, because if we take a short term view, ultimately that may well harm our economic future in a way that the politicians don't particularly grasp, or maybe don't care about because they've got quite short-term priorities. But cities are at the forefront of that threat. And for example, in terms of non-communicable disease, which is the focus of our work, if we think about air quality and the links that we've already found between areas of poor air quality and increased risk of COVID-19, we can see there is a dramatic, stark relationship between the way that we seek to manage risk around non-communicable diseases and the impact of shocks on the system, such as the pandemic. So, what are the solutions? Well, what we seek to do in our research project, where there's a link at the bottom of the screen there, which hopefully you can now see. So the TREE project has a website which describes what we're doing. But basically, we see that decision makers need help at the upstream level, which then impact on downstream decisions and people's health and well-being. And so we've got a set of questions in the paper which aren't necessarily easy to answer, but we think they need posing. How can we change the system? All these questions relate to how can we change this system, which at the moment doesn't work, and it results in inequality and negative health and economic and social impacts. So how can we transform that system at that upstream level with those decision makers, both industrialized and developing countries, and all countries in between? How can we reorientate the way that people think about upstream level to take into account health and well-being? And so TREE focuses at the urban development level, and we've got partners in Manchester and Bristol looking at that. But although we're focusing on the UK, obviously this is a global problem. And if we are really to tackle non-communicable diseases and the way they impact and are exacerbating shocks to the system like the pandemic, we need to radically rethink how we engage with those upstream decision makers. Thank you.
Paul, thank you. That, even though there was a problem with the slides, that came across really clearly what the project's about and the whole approach of going upstream. So it's not just about how to design whatever it is, parks for equity or whatever. It's going further up, or neighborhoods. It's why these aren't being designed like that in the first place when they're implemented. What are those upstream drivers of the built environments we live in? So finally, to Caroline Brown, co-author of From One Pandemic to Another, Emerging Lessons from COVID-19 for Tackling Physical Inactivity in Our Cities. Over to you, Caroline.
Thanks, Marcus. Can I just check that you can see my slides?
We can see the slides in the slide format view. We can see the you know, not in presentation view?
Has that changed it?
Not yet. It might.
I think I'm not sure.
But we can see it. We can see them.
You can see it. Okay. Well, let's go with that. Well, thank you so much, Marcus. And really interesting to be following up on some of the discussions that have already happened, because I think there are some clear links with the previous papers. So in this paper, this rather interesting group of us came together from quite different and diverse backgrounds, interested in the way in which the pandemic was going to affect and was affecting patterns of physical activity. And because of what has been called, a pandemic of inactivity and the health risks of physical inactivity, which are long recognised. So in that paper, we're really talking about and interested in the rapid and the very radical change in patterns of physical activity that happened. That's the kind of everyday physical activity for all groups in society. So thinking about how our travel patterns changed, how our patterns of exercise and leisure time changed, how our patterns of using the city and the neighbourhood and the spaces around us was changed. And we noticed and were interested in a number of different things that were going on, and we can pull out, I'm sure you can all think of your own examples of how physical activity patterns were changed by the pandemic. But this is just a little kind of summary of the things that we picked up on in the paper. So lots of negatives. So the loss of indoor sports facilities like gyms, swimming pools, because they closed. The closure of organised sport. So even football clubs and rugby clubs and tennis and those other outdoor sports, they shut, they stopped. So those opportunities were lost. The loss of active elements of commuting patterns and normal behaviour in the city. So the everyday movements that we used to make, going to work, going to the shops, going to the park. And a lot of us, and in that first lockdown period, were very constrained in the things that we were permitted to do by our governments and our local authorities. In some places, children were not allowed to go out at all. Only one person from the household could leave the home with permission to do an essential task like go and get medicine or food. In other places, people were permitted to leave their homes for a limited period each day for physical activity, but they were told not to stop, that you were allowed to walk or cycle or run, but you shouldn't sit, you shouldn't have a picnic, you shouldn't stop and talk to others. There's lots of constraints about what was and wasn't allowed. So restrictions on the time out of the home. But at the same time, we saw lots of advice encouraging people to go out of the home, to take the opportunity to get fresh air, to use local blue spaces and to go to natural spaces. And we saw messages communicated about the positive impacts of that on people's well-being in the context of lots of other things being not allowed. So saying it's good for you to go outside to see nature, it'll help with your mental health. And some other possibilities for some people, that not having to spend time commuting actually freed up time, personal time outside of work to do physical activity. And so there have been some positives for some groups in society, not everyone. And another there's a really interesting section, I think, in the paper, which talks about the way in which the home has been reimagined as a place of exercise. So we saw quite well-known sports people and famous people promoting home activity, home exercise programs. There was a program in the UK with a very famous YouTuber. He ran everyday live workouts for children I think for 10 or 12 weeks solid in the first lockdown. And so reimagining not only things in the home and activities in the home, but actually reimagining what public space could be used for, what types of physical activity can go on in public space, and making places multifunctional so that they're not just seen as places to walk through or places to sit, but actually could be places to play or to exercise. One of the really interesting things about thinking all of this was the way in which our focus completely changed overnight. Because of lockdown, all of us were forced pretty much to stay at home, and our geographical frame of reference then became our neighbourhood. And so I think in the paper and in our discussions as the author group, we were very interested in that reframing of our lives. We know from previous research that some people's lives are very focused on their neighbourhood. They move around locally, they use shops locally, they work locally, they do everything within a small radius of their home. But for others, they respond to the city region. They work in another city, they travel by train, they go to the gym across town. Their friends are located throughout the city region, and they might well spend an evening socialising on the other side of the city. And for those groups, their daily lives were frustrated and changed in much more radical ways than for some others. But the neighbourhood focus, I think, is a really interesting one. And I think there's lots of really interesting questions about policy at the neighbourhood level, and we'll come on to that in a moment. So in the paper, we discuss and consider what's happening and what might be happening around physical activity and the impacts of the pandemic on that activity. And we set out a series of questions in the paper. So how can positive behaviours from before be maintained or replaced with alternatives during the pandemic? How can new behaviours be supported and maintained in the longer term? And we were noticing as we wrote the paper that local authorities were talking about temporary interventions, pop-up cycle lanes, the creation of new spaces for pedestrian movement in the town, in cities, restricting motor vehicles. So how could that be used? How could those be used to encourage physical activity in the short term, but how can we maintain those in the longer term? We also talk about the impacts and their variability across society. And of course, health inequalities is written throughout all of these things that we were discussing, but clearly looking at the differential impacts on groups. So if we look at young people, for example, young people not only lost gyms and organised sports, but they also lost the opportunity to play sport and be physically active at school.
One minute there.
Okay. And just a personal anecdote, my 14-year-old son cried when he was told that when his rugby club was shut. It means a lot. It means a lot to people, some of this. So these were the questions we were asking. How can those temporary interventions, who do they benefit, and what evidence do we have, and how can those be perpetuated in the longer term? And I just wanted to finish, if you like, with a few sort of reflections on where we are now. I think the rapid change that we saw and the temporary interventions give us hope about the future, that local authorities and governments can be nimble and agile in the response to a crisis. I think that the emphasis on neighbourhood and place has been growing in policy that was already happening, but I think is now heightened in the discussions around the post-pandemic and post-COVID worlds. But again, as in many other places, the evidence base is critically important. Collecting data is really important, and having the type of data that allows us to show and understand the impacts on different groups is also essential. Thank you.
Thank you, Caroline. Yeah, can I ask all panelists to put their videos on so we can see everyone? Great to have you with us again. So a great set of presentations there, but all very different reflections. And if you dip into the 51 papers that we've published, you'll find, 51 different perspectives, if you like. And what I'm interested in really is with all these different perspectives, does it build any bigger lesson or insight across them? I mean, it's difficult to see, maybe just dipping in with 4, and hopefully I'll have time to show you some of these short video advocacy abstracts from some of them. But let's just have a few reflections from people in the panel. I don't want to go through the whole panel. We'll dip in again later. So not going through the whole panel, we'll use up the final half an hour, but particularly if people have something to build on these ideas of, are there lessons emerging? I mean, will we all just have 51 disparate papers, or is there a way of building lessons, maybe at the international level? And particularly, I'm interested in how better, as a sort of urbanist, how better to share between cities that maybe in different countries, but have similar contexts, maybe even in some in low middle income countries and some in high income, but there's something similar in the grain or the way we're using them. So we don't have to keep reinventing the wheel and rediscovering the answers in every single place, but we can start to build consortia and share where we have similar problems that might have similar solutions. So just, to take a couple of responses to that. Don't feel you have to respond. Put your hand up if you want to respond, and then I can draw you in. Yeah, Paul.
I think the one thing that kind of strikes me about the pandemic is that although people's contexts around the world are very different, the actual shock that we've been experiencing to the system is very similar, because it's all related to the same pandemic. So it's an awful experience. Hopefully a positive that might come out of it is this renewed way of looking at how a focus on place and environment and a recognition of inequalities is actually not just important in terms of just health and well-being, but is important in terms of the economic shocks associated with it, and the shocks that politicians might be more likely to listen to, and that by investing in areas like better environment, it may, in the context of climate change, we may be able to persuade those who make those decisions at that higher level to do things differently, and that it will help, hopefully, to mitigate some of the future shocks, whether it be climate change or the next pandemic. Not that I want to mention the next pandemic, but there will be one, because there's been lots in the past. So, yeah.
Thanks, Paul. Yes, that's right. We have all been through a common experience. I mean, that was how you began that. Whatever the differences are, there was a common threat or experience, as climate change will be. It'll be manifest in different ways, but yeah. Anyone else to build on that or address that? No. Yeah, Luke, yeah, go for it, Luke.
Yeah, I joined Paul saying that, well, the planet has experienced 3 global shocks, yeah, the 9/11, the climate change, and COVID now. And it's each time a wake-up call to change something, because even 9/11 is the consequence of a lot of things which are related to poverty. It's not only about radicalism. So it's really 3 big shocks, and the world is just changing before our eyes, yeah. And one take-home message is that less connectivity as it is now, because of a consequence of this lockdown, well, it's also not a solution, because less connectivity between people and nature will lead to more fragility and less resilience, because we get less immune, we get more allergic reactions, just as a few examples next to other examples. But it's not a solution to separate people and nature. So there has to be the solution is to live together in an integrative way with nature, but in a secure way. Yeah. Thank you.
Thanks, Luke. Thanks. That's very interesting. Very interesting what you're saying there. And what we've got time for one other. Then I want to move on to those video abstracts, advocacy abstracts. Anyone else? Yeah, Caroline.
On this question about how local authorities or the sharing of experience, I think that there's going to be a role, an increased role for the types of networks that we've seen for sustainability between local authorities. So we have European networks for local authorities working on sustainability. We've seen that in the as well on different challenges within policy. And I think we should be seeing the same thing on COVID and the urban policy responses to COVID, that sharing amongst local authorities around the world. There are many organisations that do that sort of thing, but clearly we need them to help with the dissemination and discussion about practices and what works and what didn't work under which circumstances, because although many of the responses were similar, there have been significant differences, as we've seen lots of discussion about what lockdown has meant or not meant, and how, you know, have schools been open or not open, you know, what's happened around pop-up cycle infrastructure and those sorts of things. And I think lots of work to be done of sharing that and working out the lessons, because that shock, that climate change shock, hasn't happened yet. And that's coming, and we need to, I think, you know, respond to that risk in the way that we have to the COVID risk. So I'm hopeful and despondent all at the same time. But yeah, I think local authority, those networks of researchers and practitioners sharing experiences is going to be really important in the future. Citizen Health has a role to play.
Great. Citizen Health, the journal there has a role to play. You may be meaning. Anyway, let me share with you what we're doing. We're inviting in tranches. In the end, it will be all 51 authors to put together some little advocacy abstracts to describe, video abstracts to describe their work. Now, let me just see if I can share with you and show a few of these now. Yes, I think you can see this screen. Can you see that screen? And maybe you can hear this video abstract. So this is why African women and girls are voices not heard in the fight against COVID-19, which sort of links a bit with what Caroline was saying about the voices not heard. Do wave at me or something if you don't get the audio.
Hello, my name is Gertrude Morgan Datsy.
I'm Katisha Ebron.
And I'm Dr. Mabel Kipenda.
We published a paper titled Why African Women and Girls' Voices Are Not Heard in the Fight Against COVID-19.
During the COVID-19 lockdown, we were each in different African countries. Gertrude was in Ghana, I was in Egypt, and Mabel was in Zambia. We were having a conversation about the disparities African women and girls were facing. The inequalities that women faced were amplified because their needs were not being met. Yet it was particularly noticeable amongst women and girls in Africa, and the decisions or lack of decisions made on their behalf concerning their health and in the health field in which women dominate.
We were inspired by direct observations and anecdotes on the ground, seeing, hearing, and listening to the challenges shared by female healthcare workers. We reviewed articles, fact sheets, and reports on COVID-19 and gender studies. We also saw news articles elevating female leaders who were managing COVID-19 effectively, and little about the innovative ways African female leaders were responding to the pandemic.
Our paper highlights the need for women and girls' voices to be heard within all sectors, and the burden of care that women take on within families while putting their own health at risk. To take action, African women and girls' voices should be empowered at all societal levels to let their voices be heard on their needs. We call for a need to first recognize these inequalities, then develop enabling environments that will support women and bridge the gaps. Policymakers need to prioritize the needs of women by advocating for adequate women's representation in leadership roles. Thank you.
So that was one. I'm going to show you three quite contrasting video abstracts. This is about the public realm during public health emergencies, exploring local level responses to the pandemic.
What the pandemic did was it put a very fine point on the fact that public spaces are an absolutely critical piece of infrastructure for healthy, safe, thriving communities.
Unfortunately, in many communities, the public realm is too small to accommodate an increase in demand for walking and cycling from COVID-19.
And as people wanted to get outside of their homes and into these public spaces, they became overcrowded. So that left government with this really difficult discussion around how do we deal with this?
Restriction-based approaches are tending to fall on the most vulnerable in urbanized locations.
For example, if we were to say you cannot use that park space, what does that do for people that are living in high-rise types of settings where that is in fact their backyard?
We suspect the most successful communities in overcoming this pandemic, whilst avoiding long-term effects on health and well-being, will be those that sought to balance their actions more towards investment and education rather than punitive restrictions.
Maybe it's using parking lots for different purposes. Maybe it's closing down streets, creating quiet streets for people to walk. Maybe it's creating pop-up bike lanes.
Local government actions on the public realm taken in response to this pandemic need to be tracked.
What are the interventions that actually stick for the long term that lead to greater health within the communities that took that non-regulatory approach?
Evaluating the outcomes for social and health equity that occur from these policy and program decisions.
And I've got a final video here I want to share with you. Again, about this structural inequities, this time from the United States.
My name is Dr. Rachel Berkowitz, and along with Sing Gao, Eli Michaels, and Dr. Mahasan Mujahid, I'm an author of the article Structurally Vulnerable Neighborhood Environments and Racial and Ethnic COVID-19 Inequities. Soon after the COVID-19 lockdown began in the United States, inequities in rates of COVID-19 illness and death were evident across racial and ethnic groups, with people of color, especially Black, Latinx, and Indigenous individuals, becoming sicker and dying more often from COVID-19 than their white peers. So we developed a conceptual framework for the ways in which neighborhoods before and during the pandemic may be impacting racial and ethnic inequities in SARS-CoV-2 exposure and COVID-19 morbidity and mortality. Living in a structurally vulnerable neighborhood, so a neighborhood that has been subjected to historical and contemporary discriminatory policies and uneven economic development, in which people of color are more likely to be pushed to live, can be a source of chronic stress, which increases the risk of chronic health conditions that in turn are risk factors for illness and death from COVID-19. In addition, the changes made during lockdown to limit the spread of SARS-CoV-2 may not be as helpful for those living in structurally vulnerable neighborhoods, with essential workers living in crowded housing conditions and the contraction of public transportation systems further limiting access to healthcare. So what can we do? Place-based community development that works in partnership with communities to transform neighborhoods, as well as policies in non-health sectors that center health equity, are vital interventions to prevent and address health inequities in COVID-19 and other health outcomes. And examples such as the purpose-built communities model in the United States and the globally recognized Health in All Policy strategy can inform and inspire such efforts in cities around the world.
So, as you can see, I'm totally biased towards putting health straight in at the center of all our decisions on placemaking, on place shaping, place governance. Whoops, I've just got to stop that. So if the panel could put their cameras back on, we'll just, to finish this off, we've got the sort of final question really, final thoughts, will we see a more health-focused turn in urban policy? I mean, as you can see, these lockdown papers are still in production. We're adding these video abstracts to them. We're going to have a special issue published in the next 2 or 3 weeks that really brings them all together into one place in the journal with the editorial as well. So I want to talk about that as final thoughts. So really, what have we got here? How can we move forward with it? There was also a question in the chat for Andy that I'd just like to bring forward, which was about that potential tension between the biotic rich environments, the greening of the environments, and affordable housing. And we deal with this in the journal to some extent, looking at gentrification and public health. Where does public health fit in terms of gentrification of neighbourhoods? And then as we move forward, we'll also end up with Caroline saying a few words about the next call, or anyone really, about what, where do we go with these lockdown papers, and maybe having a second call for papers. What would that look like? Who should be involved? What's the nature of the questions? So will we see a more health-focused turn in urban policy? I'd like the panel's responses to that. Raise your hand. Yeah, go ahead, Andy.
Yeah, so well, with regards to will we see more health-focused turn in urban policy, I think there's a general shift in how we perceive the world anyway. One thing I wrote in preparation for this panel is that cities are not fit for purpose anymore because our focus has changed. So before, economic growth was the focus of cities effectively, and they were quite good at doing that. But as we move away from financial growth as the only measure of success, we have to try and understand how we implement all the good things that we want to do in cities in the future. Even just the workplace having wanting to balance work life instead of just work. There's a change in culture which is slowly manifesting in cities, but it's too slow. We need to accelerate that change. And I think part of that is actually proving that some of these interventions work, dependent on what those outcomes are. So whilst that's rather open-ended, that would be my position really. You're muted, Matt.
Yeah, thanks. I'm trying to just field some of these questions here. Yeah, someone else to respond to that? Thanks, Sandy. Yeah, Paul, go ahead.
Yeah, I think thinking optimistically, for me, looking at the shared agendas between environmental sustainability and thinking about climate change and the intersection between that and kind of more traditional public health goals around tackling communicable and non-communicable diseases, hopefully we'll kind of build the momentum. So there's obviously much more now focus on air quality again after years of thinking that air quality was kind of not an issue anymore, and that's a perfect example of how you can think about public health, environmental sustainability, climate change, and resilience. And I think there is a bit of a momentum now, but in our project we're kind of looking at it from still kind of an economic point of view partly as well. So it's like, how can you motivate people from an economic point of view to say, actually, this makes economic sense to take action on health in the urban environment. It isn't just about health and well-being, it's about economics too. So I think, although in some ways that isn't, in my heart, kind of that kind of economic argument, I think it is necessary to motivate certain actors within that space. And so hopefully by looking at that and kind of the general shared agendas, we can take things forward in that way.
Thanks.
With 5 members of the ISOCARP community of practice on urban health, we published a paper on physical distancing, children, and urban health.
Sorry about that. Yeah, others. Yeah, Martin.
Thank you. What we also wanted to add was that even though there's probably a lot of momentum to implement certain health policies in cities now, that we think that the health consequences or perhaps even the sheer definition of health will be very different in many cities in the global south. And if we think about urban problems worldwide, given the sheer extent of urbanization, demographic growth in the global south, we're actually mainly talking about a problem for the global south. And just two examples that if you, for instance, see in India, where the lockdowns have caused very simple, basic, excruciating problems like water distress for many people who cannot have access to drinking water anymore, which is a logical, well, for us, a logical policy measure to limit people movements, but which is, of course, an enormous health risk if you don't have drinking water coming from the tap in your home. And another example, a bit more from the everyday practice of Luc and myself, we often work with policymakers in the conservation sector in African governments. And from at least two countries, we heard that levels of poaching in the national parks and level of unemployment in the tourism sector and the conservation sector have increased. Obviously, because of lack of economic revenue from the national parks and lack of international tourism and hence hard cash coming in, which will, of course, have not only very detrimental environmental effects, but also very detrimental health effects, because, well, then you're touching upon the core of environmental health, and who knows, if we take a little bit a leap of thoughts, new pandemics, because of, again, new human-animal interfaces because of bushmeat. And so we think it's clear that very many things that we would consider as unpleasant but necessary policies to avoid very immediate health risks in our cities are absolutely not translatable to many cities in the south, and would even cause perhaps worse health problems in countries where it's still debated. I mean, I'm not an epidemiologist, so I don't know, but in countries where it's still highly debated how risky COVID-19 actually is for the average urban dweller.
Thank you. I've answered a few questions, Q&A, that have come up about links to one of the videos and also links to the papers. That we're still working on this, so we're pulling the papers together into a single issue. We're just sort of waiting on a final practical editorial that will really have what we've done, because there's 51 papers. That's so many to handle, so we've divided them up into themes, but also sort of cross themes, because a lot of them cross-cutting themes. So we've got a table introducing them by different theme: governance, equity, nature and health, etc. And then all the cross-cutting themes, maybe food, transport, energy. There's a sort of editorial that we're writing, a practical editorial about how to access them, and we're just getting that sort of signed off. I think the typesetters are finding it a minefield. That'll have access to them all. Once that's done, it'll be put together into one complete issue of Cities and Health, which will be our first online only special issue. It probably won't be published, or not for a while. It'll be an online issue. We're working on that as fast as we can behind the scenes. In the meantime, all 51 papers have been published. They were published by the autumn last year, but they're sort of disparate, more in order of which we've published them. It does say the COVID special issue, but they're all on the journal website, and I have put a link there into the chat. And I've also put a link to the more substantive editorial, subject editorial that we've written in the chat. So that's sort of where we're at with it. We think this is sort of quite an amazing resource because of when it was written and how it was refereed. It was refereed and written all at the same time by people who were either, by dint of the country they were in a first lockdown, or experiencing COVID first wave without a lockdown in some countries, or without what many of us in Europe have seen as a lockdown. So just sort of moving forward, I thought Caroline might kick off a short discussion about a second call, and I do want you to bring in other people as well on, and you can put stuff in the Q&A. We really think there should be a second call on this. This was the sort of first immediate responses and insights, and now we've all got a lot more experience of it. Some people have applied for funding and done empirical research. Other people have obviously read a lot of the material. So some more substantive papers. What would that call look like? Who should be involved? What should be the basic questions that we're attempting to address? Caroline, over to you but other panel members and do chip in, participants in the Q&A.
Yeah, so as Marcus says, we're talking about the second COVID call, the call for COVID papers, and we're trying to scope that now. So we're interested in the questions that we should ask. We're interested in the way that we should frame those questions. You heard Marcus telling us at the beginning of the session about how we saw the papers and the role of those papers emerging during lockdown. So they were think pieces, they weren't empirical pieces, but now we have 18 months, 15 months, 18 months of data. What should we be asking for? Who should we be asking? And how should we frame this? Somebody has suggested that we have the owl of Minerva, the dusk of reflection and hindsight as a possible theme or title for our new set of papers, but we'd like to hear from you. I think there's lots of really interesting questions about comparisons, about data, about the funding. So did national research councils switch all of their money into vaccine research, or did they continue place-based research and focus? Did they have any streams for COVID funding? So tell us what you think. So who should be involved? What should be the questions? And are there framing ways of framing this that would be helpful, that might cover some of the gaps, the intersections that we might not have explored so far? I'll just give you a moment to reflect on that. Aparna's got her hand up. Come in, please.
Thanks, Caroline. That's a real great opportunity to shape what the next steps might look like. And I know from just personal reflections of the urgent public health call, a lot of that wasn't actually public health. It was about how we were going to fund a lot of the secondary and tertiary care impact of COVID early on. And likewise, I think going forwards with what we're seeing as urgent calls around the medical management of long COVID. And I wondered, especially because of the wider determinants of health playing such a huge role in COVID, and the resilience that some communities had versus some of the susceptible issues that we have. So framing it under the complexities of cities, the ability for us to pull together, even if they're case studies, that allows us to share this next phase as we all will hopefully recover, look at the threats and issues that are to do with the pandemic in terms of economic as well as the social impacts of the policies that have been implemented differentially globally across different cities, and also to really highlight examples of best practice where we've come together in an interdisciplinary way to think about things like poverty alleviation, following significant amounts of time of furloughing and or not being eligible for furloughing, the impact of the gig economy and precarious work, the impact of the pandemic in different settings occupationally, and just to highlight some of the sessions that we're going to be hosting at the festival that looks at this. And also, I just wanted to have a shout out for our colleagues in Public Health England, especially Jane South and our colleagues at Leeds Beckett, who've been looking at place-based approaches. And I think that's where I'm coming at it from now, is trying to think about the what next in terms of the impact it's had on our communities, both locally and internationally, and how we can learn from each other, and very supportive of what the other panelists have really been saying during this session, that focused on that. We're not going to have a one size fits all. What is completely inappropriate in one place might work in another, and thinking through some of those key issues, I think would be great to hear your views on. Thank you.
Okay, thanks, Aparna. I think we might have to draw the session to a close. It's 3 o'clock. Is that right, Aparna? Greg, I'll be guided by you.
Yeah, if that's okay, because there's a couple more sessions starting now, so that would be handy.
Okay, yeah, we need to draw it to a close. Sorry, no further questions. Thanks, everyone. Thanks for the panelists. Thanks behind the scenes, Greg and colleagues in getting the session up and running technically. And yeah, thanks to all our panelists and Manchester, and thanks to all the participants for attending this session. Thanks. Big bye from everyone. Thank you. Cheers.